Hey everybody, welcome back to the Pearl Women's Center. It's one of our video educational days here, and I'm here with Dr. Erin Conlon, who I think everybody knows who she is, but she's our naturopathic physician and GYN specialist here at Pearl Women's Center. And today we're going to talk about a problem that affects, what percentage of women would you say?
Very significant percentage of women around perimenopause, and most often postmenopausally.
Yeah, most of our menopausal patients, women that are going through menopause or that are getting close to menopause, which is probably age range of what, like mid 40s?
40s, yeah.
Mid 40s on.
Average age of menopause is 51 in this country.
So the problem is something that we used to call atrophic vaginitis, also known as vaginal dryness, and we're going to talk a little bit about it. Why don't we start out with, how does a patient know that they should come in to see you for a problem like this?
Sure. So first I want to say that it's been renamed. We no longer call this atrophic vaginitis. We now call it GSM, or Genitourinary syndrome of menopause. So if a gal is experiencing kind of burning of the vulva, pain or kind of a tearing, dryness sensation, pain with sex, those are pretty common symptoms.
And let's clarify too, like, so the difference between the vulva and the vagina for those patients that may not know.
Sure.
Vulva is typically the outside, right?
Yep.
And vagina would be the inside. And there's also the vestibule, which is kind of in between, which is
Yep.
really the area between the hymen and the labia. And there can be irritation there as well.
Yep.
So let's talk about like the most common reasons that women experience GSM.
So the change in estrogen is the largest factor with GSM. So as a woman transitions from her premenopausal life through perimenopause into her postmenopausal years, there's a dramatic shift in her estrogen. And that change in estrogen has a lot of different impacts, but what is experienced by the woman is that sensation of dryness.
Okay. So estrogen being one of the most prevalent female hormones secreted by the ovary, and typically made by ovaries that are more of reproductive age. So when you've got follicles developing each cycle and you're getting ready to ovulate and try to get pregnant, that's when your estrogen levels rise.
Yep.
So during perimenopause and menopausal years, the estrogen levels drop.
Yep.
What I think a lot of patients don't know is the extremely high concentration of estrogen receptors that are found in the vagina. Yeah, and along the urethra as well.
Yep.
So when a patient's experiencing painful intercourse, dryness, something like that, they come in to see you.
Yep.
I'm assuming that you're going to do an exam.
Always do an exam.
And then what are the things that you would be ruling out? Like, what other conditions? Like, could you have an infection?
Absolutely. We always want to rule out infections, whether they're sexually transmitted infections or just changes in normal flora like BV or yeast. We want to make sure that all of those things are being managed. We can do that as a quick office visit using some testing and observation as well.
So if it's not infection, and infection, we mentioned BV, which is bacterial vaginosis, which isn't an infection like a UTI. It's more of a colonization type of situation where there's bacteria that take advantage of a acid-base balance change, right?
Yeah.
And so that can be managed with medication, but not always needs to be. UTIs, urinary tract infections, definitely should be. If you diagnose GSM then, let's talk about some of the therapeutic options, maybe the traditional ones first.
Sure.
Perhaps a couple of things that naturopaths do.
Sure.
And then we can talk about some of the more innovative stuff that we do as well.
Sure,
Okay.
that sounds great. So we'll start kind of baseline. The first order is a daily moisturizer. Daily moisturizer seems like a lot sometimes. So it can be every few days.
Okay.
I like the more vagina-friendly options, things where we can avoid parabens and perfumes. We certainly don't want perfumes in the vulvovaginal environment, despite whatever the internet would like to tell you.
Right.
You do not need a mango or floral scented genital area.
Right. What about vaginal steaming?
Vaginal steaming is not ideal.
Gwyneth Paltrow talked about that, right?
Yeah,
Okay.
that gives opportunity for burns in a very sensitive area.
Yeah, as a just say no to goop on that one episode, I'd say. So
So no perfumes, no steamings. Moisturizing can be a nice option, and then using a personal lubricant with sexual activity, whether alone or with a partner, having a lubricant that is, again, vagina friendly is important. The gold standard is using an estrogen cream.
Got it. Okay.
So there are estradiols. Sometimes people will compound and use an estriol. I don't know that there is really a big benefit with the estriol over the estradiol. I like to use a potent option, and the estradiol is a little bit more potent than the estriol. We can use all sorts of different applications. So rings, tablets, creams. I really like to start with the cream because you can use it every day for 2 weeks and give us a big, nice dose of hormone to support that tissue.
Okay.
We also, with the cream, are able to pay attention to the vulva and the vagina. A lot of times the poor vulva is just kind of left. Everybody's headed straight to the vagina to help that out, and we want to make sure we pay attention to the vulva as well.
Okay, so that's estrogen creams. Now, what if a patient has been told that they shouldn't use that? So I think that we see this with patients that have had breast cancer, and they've had like a hormone receptor positive breast cancer. They're told, don't use any hormone therapy. Are hormones safe then vaginally? I know that maybe there's some controversy about that. Okay.
So we do have selective estrogen receptor modulators, so SERM, that can be used. Really, with the estrogen that we're using, and then there's also another hormone, DHEA, which is an intermediary hormone that can be used. We use them in such low doses that they are predominantly just in the vulvovaginal environment. And so very, very often they are considered safe for women who have had a history of breast cancer.
And we always suggest, checking in with your cancer specialist, but those medications are typically very, very safe. Yeah. So that's the first line would be, so we talked about lubricants, we talked about moisturizing, we've now talked about hormonal topical therapy. What's next?
Those are my favorite go-to options, and then we move on to some of the things that we can do
Sure.
here.
So one of the exciting things that we do at the Pearl is we always kind of look at innovative technology as well. We always want to do an assessment. Sometimes we even have debates about this stuff because there may not be really great research papers, but there might be something that sounds interesting. So one of those things is the FemiLift product, which is a laser treatment for women that maybe don't want to go through all of the other things that we've talked about. We can do an office-based treatment where we basically do a carbon dioxide fractionated laser resurfacing of the vaginal tissue. Oddly, it really helps with lubrication, so kind of an interesting thing. We've got information on our website about all of this stuff. If you're interested in seeing Dr. Conlon, where can you be found? Aside from our website, email-wise, through Pearl Women's Center?
Yep, okay. You can email me. All of that information is available on our website. Easy access through our chatbot on our website.
That's right, the chatbot can help. And Dr. Conlon is also happy to do telehealth visits for an initial consultation, especially during COVID, where some of our patients aren't as comfortable coming in.
So that's for Oregon and Washington.
Perfect. Well, thank you for doing this today. Hopefully we've shed a little bit of information on one of the most common problems that women experience, and we're going to be putting out new videos like this a couple times a month. So if you have any questions or suggestions, let us know about it, and we'll be happy to do another spontaneous talk like this about a topic that might be pertinent to you. So thanks so much.